If you are a transgender woman or a crossdresser who wants to enhance your feminine appearance, you might be wondering how to get feminine MTF cleavage. Cleavage is the visible gap between your breasts that can make you look more attractive and confident in certain outfits. However, not everyone is blessed with natural cleavage, especially if you have small or underdeveloped breasts. Fortunately, there are several ways to achieve MTF cleavage, ranging from hormone therapy and surgery to non-surgical techniques. In this video, we will explore each method in detail and help you decide which one is best for you. Hormone therapy for MTF cleavage. Hormone therapy is one of the most common and effective ways to get feminine MTF cleavage. Hormone therapy involves taking estrogen and antiandrogens such as spironolactone or finasteride to suppress your male hormones and stimulate your female hormones. This can result in breast development, along with other physical and psychological changes. The extent of breast growth from hormone therapy varies from person to person, depending on factors such as age, genetics, dosage, duration, etc. Generally speaking, younger people tend to have better results than older people, since their breast tissue is more responsive to hormones. Also, some people may have more breast tissue than others due to their genetic makeup or previous exposure to estrogen, such as from birth control pills or soy products. The average size of breasts after hormone therapy is around an A or B cup, but some people may achieve larger or smaller sizes. To maximize the effects of hormone therapy on your breasts, you can follow some tips such as: eat a balanced diet that includes foods rich in phytoestrogens such as flax seeds, soy products, nuts, etc., which can mimic the effects of estrogen in your body. Exercise regularly to improve your blood circulation and metabolism, which can help your body absorb hormones better. Massage your breasts daily with gentle circular motions to stimulate blood flow and tissue growth. Wear a supportive bra that fits well and does not constrict your breasts. Avoid smoking, drinking alcohol, or using drugs that can interfere with your hormone levels or damage your breast tissue. Surgery for MTF cleavage. Surgery is another option for getting feminine MTF cleavage if you are not satisfied with the results of hormone therapy, or if you want a more permanent solution. Surgery involves inserting implants under your chest muscles or breast tissue to increase your breast size and shape. There are different types of implants available, such as saline, which is filled with salt water, silicone, which is filled with gel, or gummy bear, which is filled with cohesive gel. There are also different techniques for placing the implants, such as inframammary, which is under the breast fold, periareolar, which is around the nipple, or transaxillary, which is through the armpit. The benefits of surgery include having more control over your breast size and shape, having more predictable and consistent results, having more visible and defined cleavage. The risks of surgery include having to pay a high cost, which may not be covered by insurance, having to undergo anesthesia and recovery time, which may involve pain, swelling, bruising, infection, etc., having to deal with potential complications, such as implant rupture, capsular contracture, which means hardening of the scar tissue around the implant, asymmetry, nerve damage, loss of sensation, etc. Having to replace the implants every 10 to 15 years or sooner if they leak or malfunction. To prepare for surgery, you should consult with a qualified and experienced surgeon who specializes in feminizing top surgery. Discuss your goals and expectations with your surgeon, and choose the type and size of implants that suit you best. Follow your surgeon's instructions on how to prepare for the surgery, such as stopping certain medications, avoiding smoking and drinking, etc. Arrange for someone to drive you home and take care of you after the surgery. To care for your implants after surgery, you should follow your surgeon's instructions on how to dress and clean your wounds, take painkillers and antibiotics, etc. Wear a compression garment or a surgical bra to support your breasts and reduce swelling. Avoid strenuous activities and exercises for at least 6 weeks or until your surgeon clears you. Massage your breasts gently as instructed by your surgeon to prevent capsular contracture and improve the shape of your breasts. Monitor your breasts for any signs of infection, inflammation, or implant problems and report them to your surgeon immediately. Non-surgical techniques for MTF cleavage. If you are not ready or willing to undergo hormone therapy or surgery, you can still get feminine MTF cleavage with some non-surgical techniques that can create the illusion of cleavage. These techniques include padding. You can use padded bras, inserts, or enhancers to add volume and shape to your breasts. You can also use socks, tissues, or rice bags as DIY padding. Make sure to choose the right size and color of padding that matches your skin tone and fits snugly in your bra. Contouring. You can use makeup to highlight and shade your chest area to create the appearance of depth and curves. You can use a lighter shade of foundation or concealer to draw a line between your breasts and blend it well. You can also use a darker shade of bronzer or powder to shade the sides and bottom of your breasts and blend it well. Taping. You can use tape or adhesive to pull your breasts together and create cleavage. You can use medical tape, duct tape, sports tape, or special cleavage tape. Make sure to cover your nipples with cotton pads or band-aids to protect them from irritation. Apply the tape from under your arms to the center of your chest and press your breasts together. Be careful not to apply too much pressure or tape too tightly, as this can cause skin damage or breathing problems. Push-up bras. You can wear push-up bras that have underwire and padding that lift and push your breasts together. You can also wear plunge bras that have a low-cut front that shows off your cleavage. Make sure to choose the right size and style of bra that flatters your figure and does not create gaps or bulges. The advantages of non-surgical techniques include being easy and inexpensive to use, being reversible and adjustable, being discreet and natural looking. The disadvantages of non-surgical techniques include being temporary and requiring maintenance, being uncomfortable or inconvenient to wear, being unrealistic or unconvincing in some situations. To choose the right technique for you, you should consider your budget and availability of resources, your level of comfort and confidence, your desired outcome and occasion. In conclusion, there are many ways to get feminine MTF cleavage, depending on your needs and preferences. You can opt for hormone therapy or surgery if you want a more permanent solution that can enhance your breast development. You can also try non-surgical techniques if you want a more temporary solution that can create the illusion of cleavage. There is no one-size-fits-all solution for MTF cleavage, so you should experiment with different methods and find your own style of femininity.
We hope you found the information helpful. We know that being transgender can be a difficult journey, and we want to do our part to make it a little bit easier. If you found this video helpful, please consider subscribing to our channel. It would mean the world to us. You can also support our work by joining our membership. This will help us continue to create content that is helpful and supportive for the community. Thank you again for watching, and we hope to see you next time.